Mesothelioma is an aggressive form of cancer that develops in the mesothelium, which is a protective lining that covers most of the body's internal organs. The mesothelium lining the lungs, the pleura, heart, the pericardium, and abdomen, the peritoneum, are particularly susceptible to malignant mesothelioma. Standard treatment options for mesothelioma include surgery, chemotherapy and radiation therapy. However, the prognosis for mesothelioma is typically poor as the disease is often diagnosed late and the tumors are difficult to treat. As such, researchers are actively exploring alternative treatments that may complement standard therapies or provide additional treatment options for mesothelioma patients. Some of the most promising alternative treatments currently being studied include photodynamic therapy, PDT. PDT uses a photosensitizing drug that is injected into the patient's bloodstream or applied topically. When activated by a specific wavelength of light, the drug produces reactive oxygen species that can kill cancer cells. For mesothelioma, PDT is being delivered directly into the chest cavity using thoracoscopy or videothoracoscopy. The light is shown directly on the pleural surfaces to activate the drug. Early research suggests PDT may be able to destroy diffuse mesothelioma tumors and reduce symptoms. Larger clinical trials are underway to further evaluate the safety and effectiveness of PDT for mesothelioma. Oncolytic viruses. Oncolytic viruses are being engineered to specifically infect and kill cancer cells while ignoring normal cells. For mesothelioma, researchers are developing various oncolytic viruses including herpes simplex virus, adenovirus, vaccinia virus, reovirus and others. The viruses are designed so they can only replicate inside cancer cells, causing them to rupture and die. Early studies show oncolytic viruses may help reduce mesothelioma tumor growth when used alone or in combination with chemotherapy or immunotherapy. Larger clinical trials are still needed, but oncolytic viruses show promise as a novel treatment option. Gene therapy. Gene therapy involves manipulating a person's genes to treat or prevent disease. For mesothelioma, researchers are exploring various gene therapy strategies such as delivering tumor suppressor genes to slow cancer growth, incorporating cancer-killing genes activated by drugs, and using immune modulators and oncolytic viruses to stimulate anti-tumor immune responses. Early-phase clinical trials are currently testing different gene therapy approaches either alone or in combination with standard therapies. While still in early research stages, gene therapy holds potential as a targeted treatment for mesothelioma. Cytoreductive surgery. Cytoreductive surgery, CRS, involves the removal of all visible tumor masses. It is typically used in combination with hyperthermic intraperitoneal chemotherapy, HIPEC, where a chemotherapy drug is heated and circulated throughout the peritoneal cavity after CRS to treat any remaining microscopic tumors. For mesothelioma, CRS plus HIPEC is most commonly used to treat peritoneal mesothelioma affecting the lining of the abdomen. Some studies suggest CRS plus HIPEC may improve survival outcomes compared to chemotherapy alone for selected peritoneal mesothelioma patients. Larger prospective studies are still needed, but CRS plus HIPEC shows promise. Hyperbaric oxygen therapy, HBOT. But involves breathing 100% oxygen inside a pressurized chamber. It is thought to help mesothelioma by promoting the formation of new blood vessels, angiogenesis, to improve delivery of oxygen and chemotherapy drugs to tumors. It may also have direct anti-cancer effects. Initial research found what helped improve quality of life and reduce symptoms in some mesothelioma patients when combined with chemotherapy. Other studies found BOT enhanced the effectiveness of chemotherapy and radiation therapy. Additional clinical trials are exploring the benefits of BOT for mesothelioma. Targeted therapies. Researchers are investigating various molecular targeted therapies that interfere with specific pathways and proteins involved in mesothelioma cancer growth and survival. Some targets under investigation include epidermal growth factor receptor, EGFR, vascular endothelial growth factor receptor, VEGFR, platelet-derived growth factor receptor, PDGFR, anaplastic lymphoma kinase, ALK, hepatocyte growth factor receptor, MBT, and others. Early clinical trials have tested drugs that target these pathways either alone or in combination with chemotherapy for mesothelioma. Additional studies are evaluating biologic therapies, immunotherapy drugs and other novel targeted approaches. Targeted therapies hold promise as personalized treatments. Nutrition and lifestyle changes. While not direct medical treatments, some research indicates nutrition and lifestyle modifications may help mesothelioma patients. Studies found increased fruit and vegetable intake through supplementation or diet may provide antioxidant and anti-inflammatory benefits. On the lifestyle side, regular exercise has been associated with improved quality of life and overall survival in some mesothelioma patients. Other lifestyle recommendations to potentially help include managing stress, getting adequate sleep and avoiding tobacco smoke, which can contain asbestos fibers. Additional studies are still needed to fully evaluate potential supportive effects of nutrition and lifestyle modifications on mesothelioma outcomes. While aggressive and difficult to treat, mesothelioma research continues into exciting new alternative and complementary treatment strategies that may provide patients with additional options. Photodynamic therapy, gene therapy, oncolytic viruses, targeted therapies and others show early promise. Larger clinical trials are actively recruiting to further evaluate safety and efficacy. It is hoped that combining alternative therapies with standard options may lead to better clinical responses and patient outcomes for this devastating disease over time. Research is ongoing,